Hello, it's Harry here again, your geriatric nurse from Toronto, Canada. Just wanted to make another video in support for the care for the older adults and their caregivers. Today, I just wanted to discuss about depression very briefly. There, depression is one of the triple D's in the older adults: delirium, depression, and dementia. And it's more often than not it's overlooked because people assume that depression is a normal part of aging, but as a matter of fact it is not a normal part of aging. uh, Life events in an older adult life um, by itself can put a burden on their mood, and let alone if there are health concerns that will come their way. So one can only imagine that their mood can even be further burdened. And unlike younger people, when they get sick, they bounce back, they get better. But for the older adults, unfortunately, more often than not, they will be left with not the same as they were before getting sick. Okay? More often than not, there will be some kind of deficit after a sickness. So it's very important for caregivers to take a good look at the mood of the older adults that they are caring for, their loved ones. And always constantly inquire how they're feeling, how their mood is. Healthcare professionals, it's good to ensure that you also assess their mood by asking how they're feeling, how would they describe their mood, and more importantly, ask them how they would describe their mood based on their daily life. Is it more on the happy side of things or more on the sad side of things? There are standard tools that can be used to determine if there may be something going on in the mood of the older adult. For someone who is cognitive enough to answer you, you could use the geriatric depression scale. There is a long version, but I usually use the short version, which is 15 item questionnaire. If the person is living with dementia, there are also tools that you can use. For example, Cornell depression scale. And these tools are non-diagnostic. You always have to pair it with their other signs and symptoms. So when you are assessing mood, it's also important to assess their attention, their focus, their disinterest or withdrawal from things that they used to like to do, their sleep, their appetite, their reports of pain. Those things can be affected when someone's mood is burdened. And how can you prevent to get there? So you can know the person, and then know what's important to them, and from there you build on what is important to them, because it's different for everyone. I find that if spirituality is something important to the older adult, it can do wonders, especially outlook in life. I've seen older adults and compared their outlooks in life, those who have a positive outlook and but at the same time realistic. I see them fare better compared to others, but again, to each his own. And but there's always something that could be done to amplify their daily life as defined by them, not something that we will insist. When we are taking care of the older adults, sometimes it can be burdensome. That's where caregiver stress can set in. When we get to that point, make sure you recognize it And instead of letting them feel our frustrations, it's better to take a pause, shout somewhere they can hear you, and then just come back, because it's better to leave them with just kind, reassuring words, especially in this stage of their life. Thank you so much. I wish everyone well, and see you again next time.